मौज़िज़ नाज़रीन कराम अस्सलाम वालेकुम। सिफ्ते फ़ारूक़ी आपको सलाम अर्ज़ करता है और हर हफ्ते की तरह इस दफ़ा फिर आपके ख़्याल में के साथ हाज़िर है। इस हफ्ते हमने जिस मायनाज़ शख्सियत को अपने स्टूडियो में दावत दी है वो बहुत डेडिकेटेड डॉक्टर हैं और कम्युनिटी सपोर्ट में लीड करती हैं और उनका बहुत नाम है। तो आइए आपको मिलाते हैं डॉक्टर गुलशन हारजी साहिबा से। अस्सलाम वालेकुम डॉक्टर गुलशन हारजी एंड याली मदद, and I request you to introduce yourself to our audience. And I know you are a very dedicated doctor. You work for the community for years, you know, and you are a board of director in APNA, and you are in advisory committee also in UNICEF board of members in South America, and you are board member of Emory University. And beside that, you did a lot of job for scholarships for UNICEF. So tell us about yourself, about your personality, your childhood. So please tell something about to our audience.
Maulani Madad, Sifte Sahab. I've actually been wanting to have tea with you for a long time, and this is going to work out just perfect.
Thank you.
I truly appreciate this opportunity to come to the studio and to have chai with you.
Thank you.
I was born in East Africa, Tanzania, in Dar es Salaam, to a choice of excellent parents. I was loved, nurtured by grandparents. I also have two siblings who are currently also residing in North America. My mother lives in Vancouver. I went to middle school, a product of actually Aga Khan schools,
Good.
and went to a public high school. And in the early 70s, after Idi Amin was de-Asianizing his country, my father realized that this movement was slowly spreading to Tanzania. So for precaution, he sent me to Pakistan.
So you, sorry to interrupt you, you came to Pakistan, right? At what age you came to Pakistan?
I was 16 when I came to Pakistan.
Good.
And I went to high school, did my A-levels at the Karachi Grammar School.
Good.
Those were very interesting years. I went to a very good school, was actually feel like I was very special to be admitted to a school of that caliber.
Good.
I had 2 good years, and then unfortunately had to turn down an offer from Dow Medical College to study medicine because the war broke out between Pakistan and India, and so I left Pakistan.
So you were in DMC, Dow Medical College, and you left Pakistan. And where you went after Pakistan?
I went to Iran. I actually had a scholarship from His Highness the Aga Khan.
Good.
To study medicine in Iran. However, having gone to school for a year in Shiraz, Iran, my scholarship was gone because my parents then decided that they were going to leave East Africa.
Right.
So I could not be a recipient of a scholarship from His Highness the Aga Khan from East Africa.
So after finishing the graduation from Iran, or you completed your medicine in Iran, or you came to America?
I actually went to 4 years of college in Shiraz.
Right.
They call it Adabiyat.
Okay.
And then I had actually finished 2 years of med school when I had to leave Iran because I had a scholarship from the Queen, Farah Diba. And when she went into exile during the revolution, I obviously didn't have a way to support myself. So I came to the United States.
Good. So I interrupt you here. My audience is listening you, they are watching you. This is, I never know that Gulshan Harjee studied in Iran. First time I know. And it's very interesting. We will take a short break and our discussion is continue. Dr. Gulshan Harjee, please tell our audience that who inspired you to do all this community services, all this work, all this passion of generosity. That's I call you. You are a passion. You are a leader of the passion for the generosity. So, who inspired you?
Sifte Saab, in my life, I have seen many blocks, many hurdles, and these are very big and major hurdles of losses, of rejection, of disappointments, some to quite a serious nature. And each time the Lord has given me strength to come back. And society, community, family, friends support, nurture me. And so it is my duty to turn around and give back to the society.
Excellent, excellent. I remember the Eid. I saw him and sitting on the skins, the sacrificial goats and animal skin. And I really saw you in lot of times. I saw you in the community. Just we do flood victims charity or school charity, in Apna fundraising, in other places. You are everywhere. So my next question will be, you have done a lot of things, you have a lot of programs you have done in Atlanta community beside the scholarship, women program, Apna, and other charities in Atlanta. What else you want to do and what else you have done? Can you tell these briefly to our audience?
One of my other passions is the bone marrow for South Asian community.
Good.
It was in the early 90s that I lost a very young Pakistani patient to leukemia.
Oh.
And in those days, we, South Asian community, did not have the infrastructure to recruit donors. And despite some very hard work, many hours of standing in stalls and festivals of
Right.
India and Pakistani Day and setting up tables, we were not able to recruit donors for this young boy, and he passed away. And so I made it my mission, and I said, I'm going to do whatever I can to recruit South Asian community to the bone marrow registry.
Excellent.
And recently I was honored by the Be the Match National Marrow Donor Foundation for actually saving 5 lives with the efforts that I have been involved with the South Asian community.
Excellent, excellent work, Dr. Gulshan Harjee. I don't have words to say something, but I feel from your face, and I feel the audience are looking at you in their TV, in their PCs, computers, I see your face, how you feel about this. And so it's very good, these things inspired you, you are returning to the community, and tell me about something more about your family,
My family consists, my immediate family is my sister, who also resides in Atlanta. She is a registered nurse, also in the health field. And we have a brother who is a physician, and he practices in Canada. My mother, who lives in Vancouver, Canada, that is my immediate family.
Good.
And I have been blessed, gratefully, to have great children.
Good.
And I'm grateful for that.
So, Dr. Gulshan Harjee, my next question is, are you ready for the next question?
I haven't read anything, so I'm taking a blind test here.
Yeah, I did some preparation, but not all. I know you personally, so I'm asking questions, Always I saw you in 2010 or 11, I forgot, you were involved deeply in the UNICEF program, So what was that program? Can you tell us how you involved? What is your activities in UNICEF?
Actually, my involvement in UNICEF started quite by chance. One of my very generous patients gave to UNICEF close to $600,000 in my honor, and that's how I got involved in the board.
Excellent.
Now, when I came to the board of UNICEF Southeast USA, almost a few months later, there were the floods in Sindh.
Oh, I remember.
So we had in the community our first fundraiser, and with the help of my very dear friends, Dr. Rana Hassan and Dr. Azma Khalid, and many other physicians and close friends, we were able to raise almost $90,000 that one night.
Right. I remember Dr. Abu Bakr
Yes.
and Dr. His wife also. What is her name?
Ruhi was
Ruhi,
there
yeah.
too.
They are also deeply involved.
Correct.
I remember. So in this way you involved with UNICEF, right? So
Correct.
what UNICEF is doing in overall generally for the community?
UNICEF, as you know, is an organization that has been around for almost 65 years.
Good.
It was established in Pakistan on the very first day that Pakistan was born.
Oh.
So it has been there from the very beginning.
Right.
UNICEF is hands-on and is very actively involved in many, many aspects of human needs, from social welfare to child education, to health services, to child advocacy, to fighting infectious diseases, vaccination programs. Its mandate is huge.
So is it equally helping to our country, Pakistan, India, Bangladesh, South Asian?
Absolutely. UNICEF is active in 150 countries.
Good.
And it's extremely involved in India, in Pakistan, in Bangladesh, in many countries in Africa. It is almost global and worldwide.
Good. Dear audience, we are asking the questions to our honorable guest, Dr. Gulshan Harjee. This is another question I'm asking you with your permission. I read in the newspaper and a lot of other places you involved with some scholarships to the kids, you know. So tell our audience which kind of scholarships these are and how they can apply. You know, they are looking this program. So in the benefit of this Desi web show, they can know that they can apply to your Gulshan Harjee scholarship.
Sifte Saab, I appreciate you asking this question. This scholarship is very dear to my heart. I actually started to save for this scholarship in 1999 when my husband was shot and killed. At that time, I decided that it was important to start something that would benefit the community so that his life is not in vain. And beginning 1999, I started to fund this scholarship. And about 4 years ago, there was a significant amount of endowment that had accumulated.
Right.
And so we activated this scholarship. It is called the Gulshan S. Harjee Scholarship for Healthcare.
Good.
And what we do is we invite applications from students who are college-bound, who have just finished high school. There are many questions they have to answer. There's an application, and they have to commit to healthcare.
Good.
When we first started the scholarship, we were giving out 2 scholarships a year.
Right.
And then we went on to 4, and then 6, and last year we were able to give 8. And this year again, we intend to give 8 scholarships.
Excellent, excellent. So you see our audience, what a big program. She introduced the scholarships, and these scholarships for healthcare only, right?
Correct.
Okay, and there's a form and website, everything is there.
Correct.
Right? Can you tell the website name where they can find out?
Yes, it's decabmedical.org.
decabmedical.org, right?
And
Thank you.
you go to the foundation site.
Good.
And you can find the scholarship information. The deadline for this year has passed, but for audience members who are interested in the scholarships, of course, it'll open again next February.
Good. Very, very, thank you very much for telling this thing in Desi web show. And नाज़रीन आपने देखा कि ये बहुत ज़बरदस्त बात है कि हम देसी वेब शो से आपको ये बता रहे हैं इनकी ज़िंदगी के हालात और किस तरह इन्होंने काम किया है, और स्कॉलरशिप्स और हर कदम पे ये हेल्प कम्युनिटी की करें। तो इसके साथ छोटा सा हम ब्रेक लेते हैं और वी विल बी बैक आफ्टर दीज मैसेजेस।
For all your party needs, contact DJ Z at 678-508-5050. That's 678-508-5050. DJ Z. DJ Z.
Dr. Gulshan Harjee, one of the question is related with the Georgia Trend magazine. What is that all about? I saw your picture over there, and there are 3-4 women, but you are the second one. So tell us about that one, Georgia Trend magazine.
Sifte Saab, I appreciate that question. That magazine is published quarterly,
Right.
and it goes out to businesses.
Right.
And corporate offices, law offices, and political offices. And I was actually pleasantly surprised to be published, and I feel very, very honored to bear that title.
Excellent. And I read some of the lines, and extraordinarily, you know, and I really impressed.
Thank
Very
you.
good.
Thank you.
And थोड़ा सा कुछ उर्दू में हो जाए बात, इजाज़त है?
ट्राई करते
हमारे
हैं।
नाज़रीन देख रहे हैं।
ट्राई करेंगे।
जी बिल्कुल। एंड व्हाटएवर यू आर कंफर्टेबल, जस्ट आंसर दिस क्वेश्चन। हमारा ताल्लुक़ देखें पाकिस्तान से भी है। हम साउथ एशिया के लिए प्रोग्राम कर रहे हैं, लेकिन हमारा कंट्री पाकिस्तान भी है। पाकिस्तान की पॉलिटिकल सिचुएशन इज़ वेरी बैड राइट नाउ। दे हैव नथिंग, नो जॉब्स, नो इलेक्ट्रिसिटी एंड लॉट ऑफ करप्शन, यू नो। और पीपल आर आस्किंग अबाउट चेंज। आप समझ गए होंगे मैं क्या कहना चाह रहा हूँ। टेल अस अबाउट हाउ द चेंज विल कम। आई saw you in some of the charity shows in शौकत खानम कैंसर हॉस्पिटल, वो इमरान खान बना रहे। आई saw you over there और you are very active. So आप बताएं क्या चेंज, कौन चेंज लाएगा?
सिफ्ते साहब, आप वैसे सोचे कि Pakistan and India were born on the same night.
Right.
So, what is the difference yahin pe? We can highlight some issues. Pakistan ko main soch rahi hu, I was there only for 2 years. और मेरे observation से मैं सोच रही हूँ कि पाकिस्तान को एक revolution की ज़रूरत है. They need an intellectual revolution. उसमें जो एक लीडर की ज़रूरत है who understands the real need of the grassroots, जो selfless leader होते हैं. You know, when you think of Qaid-e-Azam, when you think of Lal Bahadur Shastri,
Right.
when you think about Gandhi ji, these are selfless leaders. They left this world without a penny in the bank account. इस तरह से लीडर जो होते हैं वो पाकिस्तान को लीड कर सकेंगे. और मैं सोच रही हूँ कि ऐसे कोई लीडर अगर आ जाए और पाकिस्तान के लिए वो रेवोल्यूशन आ जाए, जो मैं बोलती हूँ इंटेलेक्चुअल रेवोल्यूशन, कि वो पाकिस्तान को फ्लिप कर सके.
छोटा सा मैं इंटरप्शन कर, इंटेलेक्चुअल कैसे आएगा? लोग तो इंटेलेक्चुअल है ही नहीं वहाँ. 60% तो आपकी पॉपुलेशन जो है वो इलिटरेसी की तरफ है,
तो
और करप्शन है,
तो वो
जागीरदार है वहाँ पे. How?
तो that is the reason you need that leader. वो ऐसा लीडर हो जो अपर क्लास को समझ सके, और लोअर क्लास ग्रास रूट्स जो इलिटरेट है उनको भी समझ सके। ऐसा कोई लीडर हो that can fit and communicate with both these levels of people.
ये
और जो moderation में है, बिल्कुल who understands the religious aspects of the country, the needs of education, the needs of healthcare, women's issues, वो सब जो समझ सके और पाकिस्तान को फ्लिप कर सके, वो इंटेलेक्चुअल रेवोल्यूशन की बहुत ज़रूरत है।
इंटेलेक्चुअल रेवोल्यूशन की बहुत ज़रूरत है। आपने सुना नाज़रीन, एक इसी से मिलता हुआ सवाल मैं अगर इजाज़त है तो आपसे पूछूं। ये तो आपने रेवोल्यूशन की बात करी, लेकिन मुझे तो अभी ऐसे नज़र नहीं आता कोई नाम है आपके जहन में क्या? इमरान खान, ये नवाज शरीफ और ये जरदारी, ये रेवोल्यूशन लाएंगे? तो बैठे हुए हैं
हम लोग सब
इमरान खान जो है नज़र आ रहा है मुझे, और दूसरी जमातें
सबके we have seen everybody's availability, we have seen their actions, सब लोग ने पार्ट प्ले कर लिया है। एक कैंडिडेट है जिनको हमने चांस नहीं दिए हैं, and I think he brings something to the table.
Right.
And I have been doing some research on Mr. Imran Khan, and I believe he brings something different to Pakistan.
Good.
I believe that there are qualities there that we should understand and give him an opportunity to act.
सो अपॉर्चुनिटी देने की बात है, आपने सुना। और इसके साथ साथ मैं अगला सवाल आपसे कर रहा हूँ, बहुत ही इम्पोर्टेंट है, एंड थैंक यू फॉर आंसरिंग दिस इन मिक्स उर्दू एंड इंग्लिश। थैंक यू वेरी मच। नेक्स्ट क्वेश्चन इज, डू यू नो there are a lot of people in our communities that don't have any insurance at all. I know those people. When I was doing radio program, they call us, and I know gathering Abu Bakr, Farooq Sumro, and contact you also. So thankful to अपना ऐसा कोई प्रोग्राम आपके जहन में है कम्युनिटी के लिए कि जिनके पास इंश्योरेंस नहीं है, दवा के भी उनके पास पैसे नहीं होते?
Well, Sifte Saab, that is an excellent question. Twice a year we open our office, we open our facility to the community, and by the generosity of many physicians in the community, we are able to serve at any one time almost 200 patients.
Good.
Dr. Arshad Qayyumi, Apna physicians, और Dr. Shamsi, और इन लोग सब आते हैं, और we have about 35 volunteers, and we serve almost 250 patients at a time. These are people who have no health insurance, and we are able to reach them. But remember that this is incidental. जो twice a year हम लोग ये health fair कर सकते हैं, मगर what we need, and is a dire need of a clinic that we can have 7 days a week.
Exactly.
For people who are uninsured.
इसमें एक नाम मेरे जहन में भी आ रहा है, lot of shows I saw Dr. Adnan Abbasi and देसी वेब शोज़ कि जितने फंक्शंस पहले मेले वगैरह में he was putting his clinic, you know, or Dr. Abu Bakr, and you also very much involved, I know. So where should be this clinic will be?
Well, with the help of several of my dear friends in the community, we are working on a project. Of course, it's not going to happen that quickly. It's not going to happen overnight. We are doing a lot of research and hope that perhaps in less than a year, if all goes well, that we may be able to have such a facility in DeKalb County.
Excellent. तो नाज़रीन, आपने सुना कि एक और इन्होंने ज़बरदस्त धमाका किया है, डॉक्टर गुलशन हारजी, जिनको मैं कहता हूँ लीडर ऑफ पैशन, ऑफ giving something and to help the community. So the clinic will be there, the scholarships are there, and one more bone marrow plan, there is a membership you are giving to South Asians. All this, what else in your mind? इतना कुछ हमने आपसे उगलवा लिया है Tell me
उसके बाद तो
something
मैं
of-
थक जाती हूँ.
कोई लतीफ़ा सुना दें
हो
आप
गया.
हमारे नाज़रीन को. कोई साउथ अफ्रीका का या कोई पाकिस्तान का तो आपको याद नहीं होगा. ईरान का कोई लतीफ़ा आप सुना दें
नहीं, मैं आपको गुजराती का लतीफ़ा समझाऊँ.
प्लीज़.
तो
प्लीज़.
ये है, दिस इज़ एक्चुअली ट्रू. और हमें जो हमारी जो उर्दू होती है उसमें थोड़ी गुजराती भी मिक्स होती है.
एग्जैक्टली.
So this was a very close relative of ours, and she took this little boy to the barber shop. तो वहाँ barber shop को वो बताती है कि ये बच्चे का सारा बाल काटना हो, तो वो सारा means good. और वो वापस आई तो बच्चा पूरा गंजा हो.
तो बहरहाल बहुत ज़बरदस्त. आइंदा वो बार्बर शॉप पे नहीं ले जाएंगी बच्चे को. If you want to give some message to our community, is overall particularly the young generation, and you have to see and talk to them, please.
Well, my message, and this is based on experience of travel, of what I have personally experienced, is that education at whatever length is mandatory. Because in order to survive, in order to be competitive in this world, you have to be educated. And education does not stop, it's an ongoing process. And this applies to all age groups. Even people in my age group should continue to pursue further education. My other message is, no matter where you are, that you should not forget your primary land. अपना खुद का वतन को मत भूलिए. So for those young Pakistanis, young Indians, remember to give back to the land where you came from, because that was the land that nurtured you. And so when you see these charities that are coming from India and Pakistan, from East Africa, from South America, study them, study their charity navigator, look at their expenses, look at their administrative cost, and then go back, study their structure, and give back to society. Or my last message is, look after your health. I think prevention is better and easier than cure. Exercise, make it at least 5 times a week. Eat right. And as your mother said, eat your fruits and vegetables, and to this day that still applies. And most of all, I want to just thank Sifte Saab, and I want to thank DesiWebShow for bringing me to the studio. I've definitely enjoyed this tea.
मोअज़्ज़िज़ नाज़रीन, आपने देखा कितनी सैर हासिल और कितनी नॉलेजेबल गुफ्तगू इस वक्त डॉक्टर गुलशन हारजी के ज़रिए हम तक पहुंच रही है. तो ये हमारे स्टूडियो में हैं, डॉक्टर हैं और इतनी एक्सपीरियंस्ड हैं, तो मैं ये अपॉर्चुनिटी मिस नहीं कर सकता. आपने हमारे खाने तो खाए होंगे ना, निहारी, पाए, और आपने देखा होगा तेल ही तेल होता है और मिर्चें और नमक भरा हुआ होता है और टेस्ट भी होता है.
अच्छा खाना होता है.
अच्छा होता है, बिल्कुल. तो ये खाने के बाद हम फिर एक्सरसाइज भी नहीं करते हैं और फिर कहते हैं हार्ट अटैक हो रहा है और डायबिटिक हो जाते हैं और या फिर ब्लड प्रेशर. तो कुछ आप हमारा जो आपने बताया नाज़रीन को ज़रा ये एडवाइस करें कि क्या प्रिकॉशन इन खानों के साथ हमें करनी चाहिए, खाने चाहिए या नहीं. ये क्या आजकल आप देख रही हैं इतनी प्रॉब्लम्स हैं.
देखो, मेरा फॉर्मूला हर दफ़ा मॉडरेशन का होता है. आवर फूड इज़ आवर फूड, and if you look at it, there are many virtues in our food.
Really?
If you eat curry, that's a very good food. Vegetable curry, or whole wheat naan, or dal, or stir fry meat mein masala dal ke, or very little oil. Everything in moderation.
Right.
You can enjoy Desi food every night, but in moderation. You know, the nihari and paya are festive foods. You can have them once a month or so. But otherwise, daily food, salan, roti, that is very good
Excellent.
food. Yes.
What
indeed.
about exercises? आप हमारी लेडीज़ ख़वातीन को क्या मैसेज देंगी? Watch TV all the time and no exercise?
Yes, I have a solution for that. You can watch television all day long, but you park a treadmill in front of it. or park a bike in front of it. But exercise is essential to good health. और दूसरी चीज़ है कि prevention. आप once a year physical करवाएं.
Once a year.
Once a year to have a physical is mandatory.
Good. So अब हम wrap up कर रहे हैं. Thank you Dr. Gulshan Harjee for the answering this very important question. मोअज़्ज़िज़ नाज़रीन इकराम, हमारा प्रोग्राम ज़बरदस्त तरीके से जारी है. अब हम इस मौके पे डॉक्टर गुलशन हारजी से आखिरी फीडबैक भी लेंगे. व्हाट अबाउट देसी वेब शो, जो हम काम कर रहे हैं, हमारी टीम और ये जो मेहनत कर रहे हैं, तो क्या आप कहेंगी? आप यहाँ आई और हम बहुत इज़्ज़त दी है. We really impressed. We are very excited to having you here.
Well, I'm honored to be here. I think this is going to do extremely well. I think it has great potential. My advice to you is to bring people from different parts of the community. Bring somebody from, say, for example, the Afghani community.
Yes.
Or so that you have a larger audience.
Exactly.
Bring somebody from the Iranian community, for example, or from the Bengali community, from law firms, and just a wide array of businesses. And I think it's going to continue to be very successful. You can bring VIPs, from CEOs to politicians. Just to bring a wider audience.
Exactly. To bring wider audience. Thank you very much. मुअज़्ज़िज़ नाज़रीन इकराम, हमारे प्रोग्राम का वक्त ख़त्म हुआ चाहता है. इसके साथ साथ हम गुलशन हारजी से इजाज़त ले रहे हैं. थैंक यू डॉक्टर गुलशन हारजी फॉर कमिंग एंड अप्रिशिएट योर इन्विटेशन. और आप यहाँ इतने शॉर्ट नोटिस पे आ गई. थैंक यू वेरी मच. और इंशाल्लाह हमारा प्रोग्राम जारी है और अगले हफ्ते फिर किसी ऐसे ही मेहमान के साथ हाजिर होंगे. अल्लाह हाफिज़. थैंक यू वेरी मच एंड या अली मदद.